If you're over 50 and you've started noticing changes in your erections, maybe they're not as strong, not as lasting, or not as reliable as they used to be, you are not alone. This is something millions of men quietly struggle with, but very few talk about. The good news, there are simple science-backed stretches that can improve blood flow, relax pelvic tension, and help restore firmness and confidence in the bedroom. And today, I'm going to walk you through the 5 best stretches you can start using right now to naturally support harder, healthier erections. One of the most common reasons men over 50 experience erectile dysfunction is reduced blood flow to the penis. Erections depend on good circulation. When you're aroused, the arteries that supply blood to the penis widen, allowing a strong flow of blood to fill the erectile tissue. This process creates firmness and helps you maintain it. But as we age, those arteries don't always work the way they once did. Think of your blood vessels like flexible garden hoses. When you're younger, those hoses are smooth and elastic and water flows freely through them. Over time, with age and lifestyle factors, the walls of those hoses can stiffen, narrow, or develop small blockages. This is exactly what happens in your arteries. Conditions like high blood pressure, high cholesterol, and a history of smoking all speed up this process, leading to a condition called atherosclerosis, the hardening and narrowing of the arteries. When this happens in the heart, it can lead to chest pain or heart attacks. When it happens in the penis, it can cause weak or unreliable erections. It's important to understand that reduced blood flow to the penis is not just about intimacy. It's often one of the first warning signs of larger health issues. In fact, doctors sometimes call erectile dysfunction an early indicator of cardiovascular disease. That's because the arteries in the penis are much smaller than the ones in your heart. If blood flow is being restricted, you may notice it there first, years before more serious symptoms appear in your heart or brain. The good news is there are steps you can take to improve blood flow even later in life. Regular exercise, such as walking 30 minutes a day, helps keep your arteries flexible and strong. Eating heart-healthy foods, plenty of vegetables, fruits, whole grains, lean proteins, and less processed food, reduces the buildup of plaque inside the arteries. Quitting smoking if you smoke is one of the most powerful things you can do for both your circulation and your erections. Your doctor can also check for hidden issues that affect blood flow, such as diabetes or high cholesterol. Simple blood tests and blood pressure checks can reveal if your circulation is under strain. Sometimes treating these conditions improves erectile function naturally. In other cases, your doctor may recommend medications that help blood vessels relax and allow more blood to reach the penis. So when we talk about erectile dysfunction after 50, reduced blood flow is often at the center of the problem. It's not something to be embarrassed about. It's your body's way of saying pay attention to your circulation. By making small but consistent changes to support your heart and arteries, you're not only improving your erections, you're protecting your overall health and vitality for the years ahead. Another very common cause of erectile dysfunction after 50 is a gradual decline in testosterone levels. Testosterone is the primary male hormone, and while it's often linked to muscle strength and sex drive, its role goes far beyond that. This hormone helps regulate mood, energy, bone health, and yes, the ability to achieve and maintain erections. As men age, testosterone levels naturally decline. In fact, after about age 30, levels can drop by roughly 1% each year. That may not sound like much, but over 2 or 3 decades it adds up. By the time a man reaches his 50s or 60s, his hormone levels may be noticeably lower than in his younger years. This can result in reduced sexual desire, less frequent morning erections, and more difficulty achieving firmness during intimacy. Think of testosterone like the fuel in a car. When the tank is full, the engine runs smoothly with plenty of power. But when the fuel runs low, the car still works, just not with the same energy, speed, or reliability. Low testosterone doesn't mean you can't have erections at all, but it can make them weaker, less frequent, or harder to maintain. The tricky part is that low testosterone often develops slowly, so many men don't realize what's happening. They may notice they feel more tired, less motivated, or less interested in intimacy, but they might chalk it up to just getting older. In reality, hormone changes are playing a big role. Several factors can speed up the decline of testosterone. Obesity, chronic stress, lack of sleep, and certain medical conditions like diabetes or metabolic syndrome all interfere with the body's hormone balance. Medications, especially some used for prostate problems or depression, can also reduce testosterone activity. The good news is that low testosterone can be detected and managed. A simple blood test ordered by your doctor can measure your levels. If they are significantly lower than normal, there are treatment options. Some men benefit from testosterone replacement therapy, which can come in the form of gels, injections, or patches. This treatment isn't right for everyone, but for men who qualify, it can restore energy, boost libido, and improve erectile function. Even without medication, there are natural ways to support healthy testosterone levels. Regular strength training, getting 7 to 8 hours of good quality sleep, managing stress, and keeping body weight in a healthy range all play a role. Reducing alcohol and avoiding smoking also help keep hormones balanced. It's important to remember that testosterone isn't just about sex, it's about quality of life. When levels are low, men often feel less like themselves. Addressing hormone health can restore not only intimacy but also energy, focus, and overall confidence. So if you're over 50 and experiencing erectile difficulties, don't assume it's only about circulation or aging. Declining testosterone may be part of the picture, and with the right guidance, it's something you can address. Taking action can help you feel stronger, more vibrant, and more connected, both in and out of the bedroom. Another major cause of erectile dysfunction after 50 is nerve damage, often linked to diabetes or a condition known as neuropathy. Erections aren't just about blood flow, they also depend on healthy nerves that send signals between your brain and your body. When you feel aroused, your brain sends messages through the spinal cord and down into the nerves in the penis. These signals tell the blood vessels to open up and allow more blood in. If those nerves are damaged, the signal gets weaker, slower, or may not reach the penis at all. Diabetes is one of the biggest contributors to this type of nerve damage. Over time, high blood sugar can harm the small blood vessels that supply the nerves with oxygen and nutrients. Without proper support, nerves become less sensitive and less effective at carrying signals. This condition is called diabetic neuropathy, and it doesn't only affect the feet or hands, it can also affect the nerves responsible for sexual function. To put it simply, imagine trying to talk on a phone with a frayed wire. The message might come through faintly with static or sometimes not at all. That's what happens when damaged nerves try to carry the brain's signal for an erection. Even if blood flow is good, if the signal is weak, an erection may not happen or may not last. Neuropathy can also develop from other causes besides diabetes. Long-term alcohol use, vitamin deficiencies, certain medications, or even spinal injuries can all harm nerves. But in men over 50, diabetes is the most common culprit. In fact, studies show that men with diabetes are up to 3 times more likely to experience erectile dysfunction compared to men without diabetes. The good news is that protecting your nerves is possible, and even if you already have some nerve damage, you can take steps to slow its progression. Keeping blood sugar under control is the single most important step for men with diabetes. Regular monitoring, balanced meals, and consistent physical activity all help stabilize blood sugar and protect nerve health. Your doctor may also recommend specific treatments if neuropathy is affecting your sexual function. Sometimes medications that improve nerve signaling can help. In other cases, therapies that improve blood flow, such as certain oral medications for erectile dysfunction, can compensate for weaker nerve signals. For men with more advanced cases, other options such as vacuum erection devices or penile injections may be discussed. It's also important to remember that nerve damage affects more than just sexual health. Tingling, numbness, or burning sensations in the feet or hands may be early signs of neuropathy. Addressing these symptoms with your healthcare provider not only protects your intimacy but also helps prevent more serious complications such as ulcers or infections in the feet. So if you're experiencing erectile difficulties after 50, and especially if you have diabetes, don't ignore the possibility of nerve involvement. By managing your blood sugar, staying active, and working closely with your doctor, you can protect your nerves and support stronger, healthier erections. It's not just about restoring intimacy, it's about protecting your long-term health and independence. Another often overlooked cause of erectile dysfunction after 50 is the side effects of medications. Many men are surprised to learn that the very drugs prescribed to protect their health can sometimes interfere with their sexual function. This doesn't mean you should stop taking your medicines. In fact, it's very important not to make changes without speaking to your doctor. But it does mean that if you're struggling with erections, it's worth reviewing your prescriptions with a healthcare professional. Several common categories of medications are known to affect erections. Blood pressure medications, especially older ones like beta blockers or certain diuretics, can reduce blood flow or dampen the signals that trigger an erection. Antidepressants are another frequent cause. These drugs help regulate mood but can also interfere with the brain chemicals that control arousal and desire. Medications for prostate problems, particularly those that relax muscles in the urinary tract, sometimes make it harder to maintain firmness. Even over-the-counter drugs such as some antihistamines for allergies can occasionally have this effect. Think of it like this: your body is a finely tuned system with many parts working together: brain, nerves, blood vessels, and hormones. Medications are designed to adjust one part of that system to solve a health problem. But in doing so, they sometimes create an unintended ripple effect, disrupting another area. In the case of erectile dysfunction, the ripple often shows up in the delicate balance between blood flow, nerve signals, and hormone activity. The challenge is that men over 50 are more likely to be taking multiple medications, often for conditions like high blood pressure, diabetes, or heart disease. This increases the chance of drug interactions or overlapping side effects. That's why doctors sometimes refer to erectile dysfunction in older men as iatrogenic, which simply means caused by medical treatment. If you suspect your medication may be contributing to erection problems, the solution isn't to stop taking it suddenly. That can be dangerous. Instead, the first step is to have an open conversation with your doctor. In many cases, there are alternatives. For example, some blood pressure medications are less likely to affect erections and can be substituted safely. Similarly, certain antidepressants have a lower risk of sexual side effects and may be an option. It's also worth noting that lifestyle changes can sometimes reduce your need for certain medications. For instance, weight loss, exercise, and a heart-healthy diet may lower blood pressure naturally, allowing your doctor to adjust your prescription. By improving your overall health, you not only reduce reliance on medications but also directly support stronger sexual function. So if you're experiencing erectile dysfunction and you're on one or more prescriptions, don't feel discouraged. You're not alone, and there may be solutions. A medication review combined with healthy lifestyle choices can often make a real difference. Remember, the goal of treatment isn't just to extend your life, it's to help you enjoy it fully with confidence and intimacy intact. Not all cases of erectile dysfunction after 50 are purely physical. Emotional health and relationship dynamics play a powerful role, and for many men, stress and anxiety are just as influential as blood flow or hormones. In fact, the mind and body are so closely connected that even when your circulation and hormone levels are healthy, stress can interrupt the process of achieving or maintaining an erection. Think of it this way: erections are your body's natural relaxation response. When you feel safe, calm, and connected, the brain sends signals that allow blood to flow freely to the penis. But when you're anxious or under stress, your body activates its fight or flight system. Adrenaline surges, blood pressure rises, and blood is directed away from the reproductive system toward the muscles and heart, preparing you to deal with a threat. That's helpful if you're escaping danger, but it works against you in the bedroom. Stress comes in many forms after 50. It could be financial worries, career changes, health concerns, or caring for aging parents. Even retirement, which seems like it should be relaxing, can bring new pressures. Anxiety about performance itself is also common. A single bad experience can create a cycle. Worry about failing leads to difficulty getting an erection, which then fuels more worry the next time. Over time, this loop becomes a self-fulfilling prophecy. Relationships also matter. Emotional distance, unresolved conflicts, or lack of communication with a partner can weigh heavily on intimacy. Sometimes men avoid talking about erectile difficulties out of embarrassment, but silence can create misunderstandings. A partner may interpret the problem as a loss of attraction when in reality it's a health issue. That emotional tension only makes the physical challenge harder. The encouraging part is that addressing stress and relationship factors can greatly improve erectile function. Techniques that calm the nervous system, such as deep breathing, meditation, or light yoga, help shift the body out of fight or flight and into a more relaxed state that supports erections. Regular physical activity is another powerful stress reliever, boosting mood through endorphins while improving circulation. Open communication with your partner is equally important. Talking honestly about what you're experiencing can reduce pressure, increase understanding, and bring you closer together. Many couples find that intimacy improves once the subject is no longer a hidden source of anxiety. In some cases, couples or individual counseling can be very effective, especially when anxiety or long-standing relationship issues are involved. If stress or anxiety is overwhelming, don't hesitate to seek professional help. Mental health is a crucial part of overall wellness, and therapy or counseling can provide tools to manage stress and rebuild confidence. Remember, erectile dysfunction is not just a physical issue, it's a whole person issue, and caring for your mind and emotions is just as important as caring for your body. So while it's true that blood flow and hormones play a big role in erections, never underestimate the impact of your emotional state. By lowering stress, managing anxiety, and strengthening relationships, many men regain not only stronger erections but also a deeper sense of connection and peace in their lives. The final common cause of erectile dysfunction after 50 has to do with prostate health and conditions affecting the pelvic area. The prostate is a small gland about the size of a walnut that sits just below the bladder and surrounds part of the urethra, the tube that carries urine out of the body. While it may seem small, its health has a big influence on both urinary and sexual function. As men age, prostate problems become more common. Benign prostatic hyperplasia, or BPH, is one of the most frequent issues. This is a non-cancerous enlargement of the prostate that can make urination difficult, causing symptoms like frequent trips to the bathroom, weak urine flow, or waking up at night to urinate. While BPH itself doesn't directly cause erectile dysfunction, the discomfort, sleep disruption, and the treatments used to manage it can affect erections. Some medications used for prostate enlargement, for example, may make it harder to achieve or maintain firmness. Prostate cancer and its treatments can also play a major role. Surgery, radiation, or hormone therapy for prostate cancer may damage the nerves or blood vessels that are essential for erections. While medical advances continue to improve outcomes, erectile dysfunction remains one of the most common side effects men face after prostate cancer treatment. This can be very distressing, but it's important to know that doctors today have many strategies to help men regain sexual function after treatment. Pelvic surgeries or injuries are another factor. Because the nerves and blood vessels involved in erections run through the pelvic region, any procedure in that area carries some risk of affecting erectile ability. For example, surgeries for bladder issues, hernias, or erectile problems can sometimes cause temporary or long-term changes. In addition to medical conditions, pelvic floor muscle weakness can contribute to erectile dysfunction. The pelvic floor muscles support the bladder, bowel, and sexual organs. When they're weak, blood flow and nerve signaling to the penis may not be as strong. Fortunately, strengthening these muscles through simple pelvic floor exercises, often called Kegels, can make a real difference for many men. The encouraging news is that even when prostate or pelvic issues are a part of the picture, support and treatments are available. Medications, vacuum erection devices, and penile implants are just a few of the options doctors may suggest. Pelvic floor therapy is another growing area of treatment, helping men restore muscle strength and improve both urinary and sexual function. It's important to remember that problems with erections after prostate treatment are not a sign of failure. They're a very common outcome of necessary medical care. Being open with your doctor about concerns makes it easier to find solutions. For many men, a combination of medical treatment, exercises, and healthy lifestyle changes restores both confidence and intimacy. So if you're over 50 and dealing with erectile dysfunction, don't overlook the role of your prostate and pelvic health. Addressing these areas can not only improve your erections but also enhance your overall comfort, urinary health and quality of life. With the right guidance and care, there are many ways forward. Your health and confidence are worth investing in, and these stretches are one of the easiest, safest ways to take control. If you found this helpful, hit the like button and share it with someone who might need this information too. And don't forget to subscribe, because I'll be sharing more expert-backed tips on men's health after 50 that can truly change your life. Start today, your future self will thank you.